We're back in the office of Dr. Phillip Denney, who we were speaking on last week's show. Dr. Denney told us a lot of his history of how he became a doctor, kind of a philosophy of medicine that he pursued. But he made an interesting comment last time. And Dr. Denney, I want to kind of pursue that a little bit more. And you were talking about how people who, you love your patients because people who use cannabis are wonderful people to work with, and they're mellow and understanding and tolerant, and I asked you sort of about the is it the cannabis that makes them like that, or are they like that? And you said it's kind of a combination of both. But the fact of the matter is, cannabis does help people become more mellow and tolerant. It has that kind of effect on them. Why?
Well, that's a great question, Lenny, and I'm not so sure that the state of the art with the science understands as well as we would like. What we know about this is that the cannabinoids, which are the active ingredients in the plant, mimic very closely some biochemical transmitters that we make in our own body, called the endocannabinoids. We know that the receptors to which these endocannabinoids attach modulate some of the behavioral aspects and emotional aspects of our behavior. So I think that there is a combination, that there is a certain personality type that tends to gravitate toward the use of cannabis as opposed to other medicines, alcohol, tobacco, other drugs, etc. And this, I think, is because of the biochemical effect of the substances on the central nervous system. Now, how this all works out, we don't really know, but we're just beginning to tease this apart, and we're finding some very fascinating things.
Well, it seems to be safe to say that mellow people seek out mellow things, and people who are violent seek out violent things.
Well, I think that that's a generalization, and of course all generalizations are false, but I think that I would say that in general that's probably true. I think that there is a certain group of people who tend to find benefit here, and there are some who don't. I think that that's true.
So marijuana is a calming drug. It calms people down. So is marijuana good for stress reduction?
Oh, I think absolutely. This is something that's very clear. We have a large number of patients who use cannabis for chronic anxiety conditions in their various forms, and there's a lot of those. And they all tell me the same thing. They tell me, gee, doc, cannabis is a very mild drug. It doesn't seem to make a whole lot of difference right when I take it. But I find when I use it, I don't have to use the other stuff. And if I don't have to use the other stuff, my life is better. I'm much more functional. I deal with my family better. I manage my anger better. I don't have the severe ups and downs that I had before. I don't have the hangover that I get from taking the pills. So that's, for many people, that's how it works.
And does marijuana effective for hypertension?
Insofar as hypertension, insofar as one of the causes of hypertension is anxiety and stress and being anxious, yes, I think it does have a role to play there.
Okay.
Insofar as it affects the basic underlying physiology of blood vessels and their contraction and so forth, it's unclear. I think what we know about cannabis is, at least in naive users, cannabis causes vasodilatation. It opens blood vessels, and there has been some suggestion that there's a mild hypotensive effect, in other words, against high blood pressure. This appears to be fairly mild, and in experienced users tends not to be as much of a factor. So this is actually a very complicated question.
Yes.
I think that insofar as cannabis does affect the heart rate and affect contractility of blood vessels, it may have some mild and transient effects, perhaps in some cases good and perhaps in some cases not good. However, I think that for most people who are hypertensive and who use cannabis, what they tell me is that the quality of life is better, and while they can't eliminate their antihypertensive medicines, often the combination allows much better control than either one alone.
Marijuana seems to work very effectively synergistically with other medications. In other words, it makes other medications work better.
Yes, I think that's true. I think that's particularly true for the pain medicines. In my practice, about half of the patients we see have chronic pain of one kind or another. And again, they all tell me remarkably the same thing also. They tell me that cannabis, while it doesn't make their pain go away, makes their pain much more tolerable. And if they have access to good cannabis, they don't need to use as much of the standard opiate pain medications. And that combination seems to work real well for people.
Well, that's what Dr. Russo kind of found in his long-term use study, that the patients who are on the government's program getting marijuana for all these years were able to use significantly fewer of the prescription medications because of their use of cannabis.
Yes. I actually think this is quite remarkable. Most patients who use cannabis in lieu of narcotics are able to cut their narcotic dose in half. Mm-hmm. When I see a patient who's taken 320 milligrams a day of OxyContin to control their pain, and they tell me now they get by with 160 milligrams or less, boy, I sit up and take notice of that. That's very impressive. Mm-hmm. One of the things that really disturbs me about this is common knowledge, and yet my compatriots in the pain management field have been very slow to accept cannabis. Are they trying to protect their wallets? Perhaps. But I think that, again, this is one of the insidious effects of the politics here, because I think it denies a medicine that is truly beneficial to many patients who would otherwise use it quite successfully.
Now, as a doctor who you specialize in cannabis-based medicine, so most of your patients are cannabis patients. And I'm you're wonderful to talk to, because I can kind of ask you about patients if trying to find out what marijuana is effective for. And I've been talked to a number of people who have come to our meetings. All the time I talk to them, they were strung out on some kind of drug, usually meth, but sometimes alcohol, sometimes heroin. But I hear meth over and over again, and it was their use of marijuana that, anecdotally they tell me, got them off and can stay off of these harder drugs. Have you found that with any of your patients?
Well, this is a very common story. We see this all the time, and this really shouldn't surprise us, Lanny, because in the history of medicine, we've used medicines as harm reduction substitutes. Most people know about the use of methadone in treating patients who are addicted to heroin. And I would argue that this concept is not new. And if we apply this to cannabis, what we find is that many patients, just as you report, if they have access to cannabis, it makes it much easier for them to maintain sobriety. And again, it doesn't seem to matter very much which drug they're addicted to, whether it's opiates, whether it's methamphetamine, whether alcohol, nicotine, for example. I have a lot of success stories of people who've managed to stop smoking cigarettes with the access to cannabis. So I think that's one of the real success stories for cannabis.
And this is what angers me so much, because the benefit that cannabis can provide for just people who are trying to get off of drugs is so enormous, and for the people in the part of the profession that is designed to get people off of these hard drugs to refuse to recognize the validity of cannabis is to me almost borderlines of being criminally negligent.
Well, those are strong words. I'm not sure I would use those. I think that we're in the midst of a process. And I think that the way this works in our society is the process is of necessity fairly slow. We have had on the one side the government opinion that cannabis has absolutely no therapeutic benefit, and they've maintained that position for 60 years. And on the other side we have people such as myself who say, no, that's wrong. That's clearly wrong. And this is something that's going to have to be resolved. I do think we're going in the right direction. I think we're making good progress. And I think ultimately we're all going to look back at this and we're going to laugh.
Well, Doctor, thank you very much for joining us tonight on Marijuana, Compassion, Common Sense. We'll have you back for our next show, okay?
Thank you.